The Maryland P3 program is a chronic disease program for self-insured employers that provides pharmacist coaches to help patients manage chronic disease. P3, which stands for Patients, Pharmacists, and Partnerships, was started in 2006 by the University of Maryland School of Pharmacy in partnership with the Maryland Pharmacists Association and the Western Maryland Health System.
Our goal is to improve the lives of patients with chronic diseases and also to contain costs, to reduce overall healthcare costs by improving their health and improving their outcomes.
Training is funded by the Maryland General Assembly through the Maryland Department of Health and Mental Hygiene. To date, the program has provided clinical training for 170 pharmacists and treated hundreds of patients. At the core of the P3 program is the patient-pharmacist relationship. Pharmacist coaches teach patients disease-specific information, self-management skills, and overall medical management.
The pharmacist can build this personal relationship with their patients because we do see them so frequently, and really seeing them being empowered to self-manage their diabetes, to be active participants in their health care and not just sit back and say, oh, well, the medicines will do the work for me or my doctor will do the work for me, that they really need to be involved.
The P3 program is now being offered to employees in 7 companies in Maryland and Virginia, including McCormick & Company, located in Hunt Valley, Maryland.
At McCormick, one of the things we would like to do and one of the things we strive for is giving our employees the opportunity to put themselves in the best possible environment, in the best possible situation, and to give them the tools to have a healthy life and a healthy living.
They're really putting an emphasis on the employee and their health, and I think that's wonderful because there's a lot of issues that people have today with not only diabetes, but, weight control and things like that. It makes me feel good that I work for a company that finds that important.
The P3 program has demonstrated significant achievement in effectiveness measurements when compared to other national and statewide groups. After 1 year in the P3 program, less than 10% of participating patients had poor control of their A1C, compared with nearly 30% of patients covered by commercial plans or national Medicare, and 45% covered by Medicaid. Data from patient visits also showed that more than 40% of P3 patients reached the therapeutic blood pressure goal of less than 140/90 or lower. The data also showed that 73% of participants received annual eye exams, as well as an upward trend in vaccination rates and dental and foot exams.
We also saw reductions in healthcare costs. For our patients, average reduction is about $1,000 per patient per year in savings for employers.
And it doesn't really matter where you practice, whether it's in a pharmacy or teaching in a school or in a clinic or in a hospital. Really, it's all about the patients. So I think that programs like the P3 program and others across the nation really help support pharmacists in that role, to provide them the opportunities to take care of patients and to be collaborative with other healthcare providers.
As a result of its initial success, plans are underway to expand the P3 program to other disease states, including hypertension, cardiovascular disease, and mental health. The APHA Foundation is pleased to present the Maryland P3 program with a 2010 Pinnacle Award as an example of a promising practice to win the battle against diabetes and escalating healthcare costs through the power of patients, pharmacists, and partnerships.